Hello, I'm Dr. Mona Morstein. I'm a naturopathic physician at the Arizona Integrative Medical Solutions Clinic in Tempe, Arizona. I want to talk about menopause right now. So menopause with our baby boomer population is a pretty big thing happening. We actually have 6,000 women every day entering menopause. That's 2 million women a year. Now, entering menopause means that it's been a year for these women since they've had a period. That's our definition of menopause. And the average age is 51, although for some women it happens when they're 40, for some women when it happens when they're 58. So there is a widespread age range for entering menopause, right? Now, what are the symptoms of menopause? Well, menopause, we have to first say it's not a disease, right? It's not a disease that needs to be treated. It's just a time of life. But it can bring in some symptoms because what's happening at menopause is that the woman is no longer producing her estrogens and progesterones, and maybe even her testosterone and DHEA. These can all be decreased. And these are hormones that have many effects on a woman in her fertile years. So when we lose these hormones, some women, they may be fine. Other women may indeed have problems. And these are individual. Generally, of course, the most common are hot flashes and night sweats. You might have voice changes. You might have what we call an atrophic or a dry vagina. You might have some sexual feeling changes. Sometimes women are have a less libido during this time. You might have mood changes. It's not uncommon that we start gaining weight here in our abdomen because estrogen keeps our weight here in the girly areas. When we lose that, if we gain weight, it happens here. So these are some of the things that we see most commonly in women presenting with menopausal problems. The other thing that happens after menopause is that we have more of a risk of developing osteoporosis and cardiovascular disease. Now, when a woman starts having symptoms, if they go to a standard care doc, they're going to be prescribed some synthetic hormones, perhaps, and if those don't work or if they don't want the synthetic hormones, then they'll be on antidepressants. Well, naturopathic physicians, we don't tend to like the synthetic hormones because it's hard for the liver to break these down, and as a result, women can have some side effects from them. And of course, we don't want antidepressants because those are just unrelated drugs that they're giving to women that they very rarely need those. So naturopathically, how are we looking to treat women who have menopausal symptoms? Well, first, of course, we do want women to stop smoking because of the risk of cardiovascular disease postmenopausally. We've got to work real hard to get rid of that. We also need to look at the diet and make sure that the portions are under control and tidy it up in all ways that we need to make it high nutrient, high antioxidant, low pro-inflammatory, so forth, right? We also want to get the woman exercising so she isn't gaining weight and it isn't becoming abdomen weight, which can lead to insulin resistance and diabetes. We want to see what kind of nutrients does she need. We also can use botanical medicine for symptomatology or other glandulars. Sometimes it's good to support the pancreas, to support the adrenals, the thyroid, with the ovaries, because these all work in tandem. We can also use suppositories or creams vaginally if all they're having is a dry vagina, but there are also over-the-counter lubricants and moisturizers that women can use too that can work just as well. And last, we do have the bioidentical hormones, and these are really great for women who have a very severe time with menopause, lots of hot flashes, lots of night sweats, bad sleep as a result, or maybe they are having some osteoporosis. And in this regard, we use hormones that are just like female hormones. We can use them in creams, we can use them as suppositories, we can use them orally. There's lots of different ways to make the very specific formula that we need for each individual woman. So if you're a woman and you're having problems with menopause, get the comprehensive intake and treatment that a naturopathic physician can give you. I'm Dr. Mona Morstein. I'm at Arizona Integrative Medical Solutions. Thank you.